Dear Heavenly Father, we just thank you for this day, just thank you for this community. We just ask us as the board gathers to be with them and give them the guidance and strength and knowledge to make the decisions that they need to make for the healthcare within this community. I just ask that you be with the employees of organizations that take care of the healthcare needs of this community. And we just ask that you be with those families throughout the state who have lost loved ones in recent floods. Just watch over them and give them comfort that they need. In your name we pray. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Michael, thank you. Dr. Burrows, would you show all members present?
Yes, sir.
And at this time, item number 5 is we will go into executive session to potential providers. The Somervell County Hospital District will convene an executive session to receive a report by the compliance officer regarding the evaluation of medical and healthcare services pursuant to section 161.032 of the Texas Health and Safety Code. It is 7:17 p.m. on 5/28/2015. We are now in open session. Does anybody want to make any sort of motions on what was discussed in the executive session?
I would like to make a motion that we confirm the recommendations of medical staff for reappointments to medical staff. Dr. Robert Burgos, Dr. Nicole Mueller, Dr. Shannon Mueller, and Kevin Vandenberg. We're going to remove from medical staff Dr. Robert Lee and add additional privileges for Karen Burrows and Julia Hutchinson.
We have a motion. Do we have a second?
I'll second that.
We have a motion and a second. Any discussion? All in favor, raise your right hand. All opposed, same sign. Show that it passes 7-0. All right, at this time, we're going to go into executive session to discuss some stuff with our lawyer to see how we should proceed with item number 6. So at this time, the Somervell County Hospital District will convene an executive session pursuant to 551.074 of the Texas Government Code to discuss with its attorney, either in person or by telephone, any matters pursuant to section 161.032 of the Texas Health and Safety Code to discuss and qualify of related issues. All right, the time is 7:48 on May 28th, 2015. Show that we are back in open session. There is no action to be taken on item number 6. Item number 7. Item number 8 is discuss and necessarily take action on amending approval of minutes from previous meetings from May 14th, 2015 at 7 o'clock and May 14th, 2015 at 7:30. It was in y'all's packet. I'm assuming everybody had an opportunity to look that over. Is there any corrections or addendums to be made to that? All right, so
I'll move that we approve those.
So we have a motion. Do we have a second? Brett seconds. Any discussion?
That for both sets.
Yes, for both sets. We're going to do it all as one big happy family. So no discussion. All in favor, raise your right hand. All opposed, same sign. So it passed 7-0. CFO report. Ms. Wisnick, would you please tell us how great we're doing?
In your packets, you'll find the PowerPoint and the financials that were reviewed at Tuesday night's Finance Committee. In April, the hospital had 43 admissions with a budget of 65. The prior month admissions were 55. Gross revenue for April was $3,728,289. Our salaries on the hospital side, $507,024 with a budget of $498,002. Our employee benefits were at $196,946 with a budget of $198,080. Our net revenue was at $1,081,899 with a budget of $1,064,405. Looking at some of our markers, our salaries as a percent of net revenue, we were at 47% with a benchmark of less than 47%. Our budget versus actual salaries, we were $9,022 over budget. Our ratio of salary and benefits to net revenue, we were at 65% with a benchmark of less than 65%. Some of the expenses that we reviewed, supplies for April, $176,964 with a budget of $203,200. Professional services at $149,933 with a budget of $163,967. Repairs and maintenance, $26,482 with a budget of $28,012. Our indigent care, we were at $29,118 with a budget of $41,341. And for April, our total expenses for the month, $1,325,586 with a budget of $1,388,375. Our cash collections were at 93% with a benchmark of greater than 98. And our days of cash on hand were at 26 days with a benchmark of plus 45. Our hospital collections were at $1,003,042 and our net revenue, $1,080,302. The next page shows our cash flow on the hospital side. For April, collections and other revenue, $1,385,507. Our expenses minus depreciation, $1,254,468, leaving us with a cash surplus of $131,039. And year-to-date, collections and other revenue, $9,681,054. Expenses minus depreciation of $8,775,919, leaving us with a positive cash flow of $905,135. On the consolidated side, which includes hospital and clinic, for April, our collections and other revenue, $1,617,668. Our expenses minus depreciation, $1,622,370, leaving us with a cash deficit of $4,702. And year-to-date, $11,225,102 in collections and other revenue. Expenses minus depreciation of $11,337,484, leaving us with a cash deficit of $112,382. I would like to mention that on the consolidated side for April, if you're looking at the financial statement, the income statement, it does show that our year-to-date revenue for the hospital and clinic, we're at $114,909. No, that did not come out right. Let's do that again. $28,114,909 with a budget of $28,119,234, leaving us with a variance of only $4,000. So we were close to budget on revenue, but better than that, our expenses for year-to-date, we are under budget by $670,218. And then briefly on our UC, we're expecting to IGT some money up at the end of next week. The schedule is showing that we will be IGTing up $115,623. We're expecting back $279,890, but that is subject to change depending on the haircut. Meaningful use, we're still not sure when we'll get money for that, but we have met all of our core measures. That's all I have.
Something we discussed Tuesday, that I wanted to make sure the rest of the board understood this. We
Yes,
have bills we're not paying right now, that we have bill collectors calling us to collect, right?
yes.
So we don't have enough money to pay all of our bills right now. And we're gonna,
We do
we're
not
gonna
have enough
get
money
a
to
loan.
send all of our bills paid out the door today, no.
Right, and I believe Mr. Reynolds mentioned that you guys may be coming to us, ask us to approve a loan just to make payments on our bills. Is that right?
Well, that's, yes, and that's because we're expecting some government money that hasn't come through yet. And, you know, we're at their mercy.
Sure.
We have no idea when it might be coming in.
Sure, I just didn't know if the rest of the board knew that.
Oh, absolutely.
And you'll be seeing a schedule next month, and we're preparing a schedule of what our expectations are from 11 to 15, from Medicare low volume, from Medicaid, meaningful use. I mean, there's dollars out there, so we'll bring that to you and at our next finance meeting, the budget finance committee, and then we'll present that at our next board meeting. We're preparing that for you right now. Good call, appreciate that.
Anything else?
The $600 and some odd thousand under budget was for what period?
For ex-
Education.
It's year-to-date, for year-to-date,
Year-to-date.
and that's on the consolidated side, so that's hospital and clinic together, we're under budget $670,000 on our expenses.
Well, I don't know who we need to commend, but they need to be commended.
I think
Well,
all
let's
the
give them a
departments.
hand.
Department managers, that's it.
Absolutely.
All right. Item number 10 is our CEO report, so Ray.
Yeah, I have a couple of items to discuss with you, really from last month's meeting. The first was had to do with an RFP, issuance of an RFP on the anyone that was interested in leasing the hospital or perhaps even purchasing. And what I did on that is first of all, I called our accounting consultant BKD and talked with Deborah Whitley, who's with that firm. I talked with her about issuing an RFP. What she suggested that I do is talk with the hospital that had gone through this process. So she referred me to the CEO of Sulphur Springs Hospital, and they have been actively engaged for over a year in trying to identify a strategic partner for them to go forward with. And they have identified what that hospital or hospital system, who that will be, and they didn't share that with me. But in talking with him, he then referred me to the consultant that did all of their work for them in terms of preparing an RFP and taking that RFP out into the public and helping them find a strategic partner. Well, in visiting with him, and I sent this to each one of you. Each one of you should have received a packet of information from the consultant. But you know, his number one point was, before you start issuing an RFP, you should do a strategic analysis of where you are and then what are your absolute requirements in terms of accepting a strategic partner or selecting a strategic partner, and then what are the items that you would be willing to be flexible with and have that discussion. So it's an involved process to do that. That first step would take about 90 days to do that with this consulting firm, and the cost would be $25,000 to $30,000 for that. Once you've done that, then you would be prepared to issue an RFP, and you would in this RFP identify the things which you would absolutely have to consider a partner, and then those things that you would be willing to negotiate. Sulphur Springs has taken them, it's been a year from the time they started, and they've spent about $100,000 in the process. But they've been actively chose to go out and find a strategic partner. Interesting. One of the reasons for that too is really one of them is that they had some bonded indebtedness, which required them to have 60 days of cash on hand. They were down to 60 days of cash on hand. The other item was that they were at the maximum, their hospital district, they were at the maximum rate that they could tax. Their hospital district was enacted through special legislation, and I don't recall what their tax rate was. I believe it was 24 cents, but I'm not certain about that. But they were already at the maximum they could tax. So that's kind of a little bit of a synopsis of what you asked me to do in terms of bringing you information regarding the issuance of an RFP. I'll be happy to try to answer any questions from the board.
Quite frankly, the statement that I would have to make after that, Ray, would be that unless, in our situation, just because of what Mr. Harper brought up, that we have trouble paying our bills, we don't have the extra money to go do that. And I think up until such time as we felt like we had someone interested in this hospital, if you go out and spend money like this blindly and you wind up with no takers, then you just wasted a lot of money that we can't afford to waste. So I think this tends to show us that we've got to keep our nose to the grindstone, keep the hospital open and operating, and there may come a time when someone may show some interest, and then maybe we'll be in a position where we can spend some money to do what we need to do. But otherwise, I think it's wasted money.
Well, Ray and I discussed having a strategic planning committee or a strategic planning meeting sometime here in the next 2 or 3 weeks to start, kind of kick off our budget process for our next budget year. And so I think it would probably be the smart thing there is to discuss it while we're discussing the budget and this, that, and the other.
Yeah, because you're talking about spending some bucks, and it's
Yeah,
not,
I think it's going to be 6 figures. And so I don't think it's a, we win the lottery, Saturday night, maybe we do something like that. But until we get the right 6 numbers, I think we trudge along like we are.
I do think the first step is for us to do the strategic planning session so that we can identify what our long-term goal is and our short-term goal and how we're going to get there. I absolutely agree.
Yeah, I think what a lot of people do not understand is it's not just as simple as running an ad in the paper asking if there's anybody who wants to lease our hospital. There's a lot more to it than that. I was aware of that because of what the county went through in 1993 when I took office as county attorney. It took us a 9-month period of time and a lot of money spent to get the lease of the hospital done correctly. So.
Mr. Chair, any action you taken on that?
I believe so.
Okay. The next you asked me to take a look at the posting the check registers online, and I did. I checked with our attorney, and I've got an email from him that I'll pass out to you. I did not include this in the packet. I probably should have, but it's there for you. His answer is quite correct. I will say that, but you can read that for yourself whenever you get it.
Well, I think what really separates our checkbook register from most government entities is HIPAA. And I think by the time we redact that, I think it's going to look like the blueprints for Area 51. There's not going to be anything left on the sheet of paper other than some numbers. And for what it's worth, anybody can do an open records request for any piece of paper we've got in the hospital that doesn't have somebody's name on it. We'll certainly redact that to be compliant with HIPAA. But if somebody
statistics.
Do what now?
Or valid statistics.
Agreed. But, we're not going to violate HIPAA, but if someone in the community wants to do an open records request, Ray and I have already discussed it, Kevin agrees, we're going to fully comply with that, although it'll be redacted and it'll have a lot of black lines on it where it's not, it's not going to show that Miss X, got a refund from the hospital so that we don't know that they went to our hospital. And I think HIPAA's a good thing, so I don't want to trample on it ever.
So I'll make a motion that we post the check registers and redact the customer's information when we do so.
All right, we have a motion, we have a second.
Can we come up with an easy way to do that?
Well, hang on.
Hang on, we have a motion on the floor, and so we can't have discussion unless we have a second. We had discussion a while ago. So, we have a motion that we post the checkbook registers online. believe the motion dies for lack of a second. Now that we're back into pre-motion mode, John, do you have anything you'd like to ask?
I think that we would need to figure out how we could easily, without a lot of extra expense or man hours being put in, to be able to redact it. Like perhaps number our physicians and our patients, patient 17 to 35.
Becky, this is going to wind up on your desk. Tell us what you think.
I think that'd be another way.
That's a short email, written in.
Yeah.
I was just going to say that a lot of the checks that we send out are due to purchase orders. There's not going to be any information. It'll just have the vendor name and the amount. We'd have to go into materials management to get, to get more details on the purchase orders that go through there. What I give you is just a standard report that comes out of CPSI. Could we do another report? Probably. I'd have to talk to them. I don't know how much trouble that would be, but that's all I know.
Could we maybe have a separate, and I'm not trying to reinvent the wheel, I'm not ever going to try and tell you how to do your job, because that is not my strong suit. Could we maybe have a separate account that we do patient refunds or something out of, or is that asking too much?
A separate bank account that we could open up just for patient refunds?
Just a separate deal where, it has HIPAA wrote at the end of the check number or whatever, so that those don't show up on the register when they're printed or what. You see what I'm saying? Have it in a separate account?
Oh, so you're not talking about a separate bank account, you're just talking about like different check numbers or something that would,
Yeah, just,
that would flag that somehow, they don't
I'm
show
asking.
up? I would have to ask an IT person, I really don't,
right.
I don't know. But we do have the, at the finance committee meeting, we do have the ability to pull up CPSI as we're sitting there. If you have any questions, or if anybody had any questions, they want to come to the finance committee meeting and see the check registers, I can pull them up right then and we can look at it.
But there's a big difference between having it in the boardroom and having it on the internet.
True.
Okay. So does anybody have any questions for Ms. Wisnick before we trash down? All right, so would anybody like to make a motion?
I already made one.
Would somebody like to reword their motion that maybe we have somebody look onto this and come back to us here at our next meeting and see if there's some sort of happy medium for everybody?
Well, I would move that we let Paul look at it and try to figure out what we can do to bring it back and let us know.
All right, so we have a motion. Is there a second to that motion? All right, I believe it dies for lack of a second, and so I've about beat that horse as far as I'm going to beat it, and so y'all can leave it to water. I can't make it drink. All right, committee reports. Ms. Van Zandt, would you tell us about the quality meeting, please? Or the quality committee, I'm sorry.
The quality committee met on Tuesday, May 5th at 5:30. And when we reviewed the focus dashboard for the hospital, we had, for the month of March, 3 unplanned readmissions within 30 days with related or same diagnosis. All 3 of these charts, both the initial visit and the second visit, were reviewed by physicians. They were all deemed to be unavoidable, and the maximum medical care was being given and appropriate. There were no healthcare associated infections, no invasive procedure-related infections, and our total hospital-acquired infection rate for 2015 is still currently at 0. We did have 3 falls in the month of March, and we will discuss, we'll go into deeper detail in the falls later on in the report. There were 2 on med-surg and 1 in the ER department, but none of those falls had any injury, and there were no other injuries to patients within the hospital. There were no never or sentinel events, and our ED patient acuity level is staying consistent at a level 3 at 64.5%. The ED monthly average length of stay was at 117 for the month of March, and there were 618 patients seen in our emergency room in the month of March. The other thing we looked at was the patient's falls, and for year to date after March, we had a total of 15 falls in our hospital to date. We also did a falls for 1,000 days, percent of falls per 1,000 days within the hospital, and we've seen a slight increase in our number of falls since the 4th quarter of 2014. And the quality department and nursing are working together to evaluate the possible causes of increase in the falls and to create a improvement plan so that we can address those and start to see the trend going down instead of up. June, and one of the things we're going to do is June is Patient Safety Month, so we will be using that to focus on fall prevention within the hospital. The next thing we discussed is we went over the numbers for the district portion of the 1115 plan, and that's where we have to have projects and we have to improve on what we planned on doing for the project. The two projects we have within the hospital are expand primary care capacity, and one of the things that we're doing on that is expanded clinic hours. We had anticipated increasing the number of clinic encounters for that time period by 150 additional patients, and we exceeded that enough to the point where HHSC has sent us an email and said, y'all have met that, you need to increase it, and they actually kind of increased it for us from 150 to 1,485 additional encounters. So if you do it well, they want you to do it better. But I did run the numbers and all that, and we anticipate meeting that, especially with the assistance of Dr. Bostic and Dr. Peters seeing patients in the on Saturday clinic and everything like that. With that, that should also enable the additional IGT for additional funds for the district plan. And that's pretty much our committee report. Any questions?
No, but I think you learned what I learned a long time ago. If you do a really good job, what they do is give you more work.
I believe we can agree to that in the hospital.
All right. Budget and Finance Committee. Is there anything else to add to that, Becky? No questions, no comments? And the Building and Planning Committee, I don't believe met in the month of May. So, all right, down to item number 12, discuss and if necessarily take action on the appointment of board members to the following committees. Budget and Finance Committee, Building and Planning Committee, Quality Committee, and other committees. And I think y'all have in your packet a list there. Who wants to get off, who wants to get on, who has any sort of thoughts about what committees they're on or would like to be on, or form a new committee, or dissolve a committee, or any committee-related stuff.
I'd like to stay in the Budget and Finance Committee.
I'd be happy to stay on the Budget and Finance Committee.
All right, well, I'll tell you what, why don't we do these by committee? So we had 2 volunteers for the Budget and Finance Committee. Is there any other volunteers, Dr. Burrows?
Sure, I would be honored to stay on that Budget and Finance Committee.
Is there anybody else that would like to be on the Budget and Finance Committee? Okay. So on the Building and Planning Committee, which is currently Eugene, me, and Brett, I would certainly volunteer to be on that again, since I think we've only met about 4 times in the last year. Would Eugene, Brett, or would somebody else rather be on it instead of Brett?
Hey, Ron should be our friend.
We built this own building.
He slipped through last time.
Brett, is that the only committee you're on?
No, I'm on the quality.
Okay, if you want to get off of that one, I'll take your spot and you can do it.
Thank you, sir.
Okay. So we're going to remove Brett and add Ron to the Budget and Planning Committee. Does anybody else want to be on there?
Building planning.
I mean, the Building and Planning Committee. On the Quality Committee, currently it's Dr. Burrows, myself, and Brett. And I've actually enjoyed being on that committee. We do meet every month, and it does seem like we get a lot of information and a lot done. I've learned a lot through the Quality Committee this past year. So I would like to remain on that one in case y'all can't tell. So Brett and Dr. Burrows, do y'all like those?
I'd like to remain on that committee too.
Okay.
I will too.
Okay. Does anybody else want to be on the Quality Committee meeting? All right. We also had another committee we formed last year, but I don't think they ever met. I don't think it ever gelled, and it was one about dealing with, now this ain't on our agenda, so we can't take any action, but we came up with one that was going to work on bylaws and rules and griping. Dr. Burrows is on that. I believe Paul is on that. And I believe Ron is on that. And so I'm assuming since y'all never got started, then y'all might as well stay on there as well.
Punishment.
Hence, hint.
What are you going to call that?
I don't remember what we called that committee. I'm sure we made up some sort of fancy name for it.
Bylaws Committee?
Yeah, maybe so.
Board Penal Committee.
All right, so now that we've kind of digested this, does anybody have a recommendation they'd like to make, or a motion, or?
I move that we do what you just said.
Okay, so we have a motion to accept the committees as changed. Do we have a second?
Second.
We have a motion and a second from John and Brett. Any discussion?
Yeah, I would just hope that Dr. Burrows would not write that motion down as it was made.
No.
That we do what we said.
If I need
Okay, so other than that discussion, is there any other discussion? All in favor, raise your right hand. All opposed, same sign. Show that it passes 7-0. Item number 13, discuss and necessarily take action on scheduling a public education forum for the citizens of Somervell County concerning the current state of the medical industry and how it relates to the state of Glen Rose Medical Center. Ray kind of explained to us, we've talked about this in the president's meeting, we kind of explained to the crowd and to the rest of the board what we think we ought to do there.
Yeah, what we're talking about here is community education about healthcare, and the suggestion has been made that we find an expert about small hospitals. One of the names that's been mentioned, and we haven't talked with him or confirmed it, is Community Hospital Corporation is an entity we have an ongoing relationship with, and see if maybe their chairman or someone in their organization, they own, manage, and consult with smaller hospitals that they provide us with our benefits, so we have a working relationship with them. Mike Williams is their president. We'd ask him first, but if not, someone either from that organization or from a like organization, we would ask him to come down. We'd have a town hall meeting, perhaps meeting here, or if we could generate enough interest that maybe we move it to the event center. It's something to provide education to our community about really the issues that small hospitals are facing all over the state and all over the United States in terms of the issues that smaller hospitals are dealing with. But we look at that as an opportunity to provide a service to the community, an education to the community, and then also to generate some additional support for the hospital, quite frankly.
But this will be on a rotating basis where we do 3 or 4 of these a year and have CHC come one time, and maybe somebody from Torch come one time, and maybe somebody come from MCARE one time, and et cetera, where maybe somebody from Carter Blood comes and gives us a discussion about how a pint of blood leaves here and winds up in New York City when they have a problem.
I think it'd be an opportunity to really, for us to provide, a service to the community and also generate some additional support for the hospital. It's kind of, that's the framework that we're talking about. Any board members have any additional thoughts on that?
How much does it cost?
We would hope it wouldn't cost us anything.
Yeah.
Yeah, that would be it.
Participation isn't split.
Yeah.
If they want to charge, they'll have to go to Granbury or
Yeah.
Cleveland,
Yeah.
but the Freemans can come here and
And this wouldn't have anything to do with politics statewide or anything like that.
our
Talking
intention is
about
to be healthcare focused.
expanding Medicare, anything like that, trying to push some agenda or anything like that. right?
Well, no, but I think it might be appropriate for someone, an expert to talk about, the Medicaid issue that we're dealing with. That's not, I know there's two sides to that politically, but certainly the hospitals have an opinion about additional coverage for Medicaid. I don't know, we'd have an opportunity to select the topics or have something put into what the topics would be. But I would think that the first topic would be just a general discussion from an expert about the plight of small hospitals across the country and the issues that they're dealing with in terms of reimbursement, in terms of indigent care, in terms of bad debts through the emergency rooms particularly. I think there's just a number of topics that we could discuss. Ask that lady to turn the phone off, please. That was my wife.
All right, is there any Any further discussion about that?
We'll bring back to you. We just want to get your input on it, but we'll try to organize get a couple of speakers that we can bring back to you and get y'all to approve before we schedule anything.
I would like to see this happen because I've run across, I've talked to people, and I've seen comments that people have made on social media and whatnot. And they, from my standpoint, have a lot of misinformation about this hospital and the medical industry as a whole. And if you don't understand what's going on in the medical industry, you don't understand the history of this hospital, you don't understand the challenges that this hospital faces, then you can't properly appreciate what needs to be done to keep a hospital in this community. If this community, I'll just tell you right now, and I'll stop right there at the very beginning, is that if this community did not have Comanche Peak Steam Electric Station here, this hospital would have went away in the fall of 1990. Put that in your pipe and smoke it. Think about it for a while, okay? I just would like to see people educated so that they do not continue to make statements that are just flat out wrong about the hospital and the condition. And it's not just this hospital, it's every hospital, like you said, across this state, across this nation.
So was that a motion?
Well, I'd make a motion that we proceed to try to set this up. If it takes a month or two to do it, that's great. Whatever time it takes, then I'll do whatever I need to help.
All right, so we have a motion, we have a second.
I'll second.
Motion and a second, any discussion?
Yeah, I'll just concur with what Ron said. There's a lot of misinformation out on the internet, and it would be good to have some third-party people come in and explain the situation to a bunch of people.
All right. Any further discussion? All in favor, raise your right hand. All opposed, same sign. Show it pass 7-0. All right, next item is item number 14. I wish I'd have been born in Rome. It says, discuss and if necessary, approve salary increase of 2% for hospital and clinic employees. And so I'm going to kind of turn it over to Ray. This was a budgeted item.
If you recall back when we were doing our budget, we were preparing our budget, we said to our employees that we did not budget a salary increase for you. You will have to earn it. And I think that our employees have certainly met the challenge. If you look on the hospital side, our total expenses on the hospital side are $444,869 under budget. Consolidated, we're under budget on total expenses $670,218. So I think our employees have certainly stepped up and met the challenge. The way we would propose to do this, it would not be a 2% across the board. There would be a couple of, qualifying issues first. The first would be that anyone, help me on this, employees, make sure I say it right. Anyone employed after January the 1st would not be eligible for a salary increase, and that's consistent with what we've done historically. The other would be if you were employed during the first 6 months, your salary increase would be prorated based on the number of months that you had worked. If you were hired at the end of the third quarter, at the end of the first quarter, you would receive 75% of what your raise would be. Sorry. Yes. And it would not be across the board. What we do, each department would be allocated 2%, and they would distribute that among their employees based on the individual employees' evaluations. And
So some more, some less.
Some more, some less. Some none, perhaps. Yes. But it would not be. It would be up to the discretion of the department manager based on the evaluation of the employees as what they receive.
All right. Any discussion or questions about that? I'll tell you one thing I'd like to say. Thank you for making our budget work. Y'all did a fantastic job. Y'all exceeded my expectations. I'll be real honest. I was hoping that we could maybe just squeeze blood out of this turnip and maybe squeeze $500,000 out, and y'all have done that. easily by the first half of the year. And I'll tell you my projection, my expectations, I think we're going to be at 1.1 or 1.2 unless the train just goes off the rails. But I think y'all are doing a great job. I think y'all took this challenge. I think y'all stepped up. I think y'all are standing there hitting home runs. Thank you, thank you, thank you.
Absolutely.
I agree.
All right, so does anybody want to make a motion?
I move we do the 2% raise the way they discussed.
We have a motion, do we have a second?
I'll second.
We have a motion and a second. Any further discussion?
Yes.
Okay.
I'll just add that I don't think we can afford this. We have bill collectors beating down on doors. We can't pay them. We shouldn't give people raises.
Well, I think according to Robert's Rules of Orders, I'm going to step down temporarily as chair, and I'm going to let John Parker step in as chair so that I can discuss this. So, John, you will have to finish this motion until it is complete. So we have a motion and a second.
And I assume you're wanting to discuss now.
I do want to discuss. I think if you don't treat your employees correctly in a business, you might as well roll up and go home. I think that 2% in this current market is chicken feed compared to what some other industries are paying. My wife just got back from San Diego. She was offered $140 an hour as an RN. It came with an apartment. She'd be on 2 weeks, off 2 weeks, get tons and tons of hours. That was no shift diff, that was nothing. I can tell you, we don't pay our physicians in the ER $140 an hour. I mean, maybe some of them do, but I mean, you don't get the drift of what I'm saying. At $140 an hour for an RN, that's nuts. And in Texas, we don't make near that. In Glen Rose, I don't think we make near that. And so I'm just saying, I think 2% is, I think if we keep working on this budget, I hope we can do more next year. And so, let the bill collectors keep knocking. I think you take care of your employees first.
And to that, Mr. President, I say amen.
Anybody else want to discuss? We have a motion and a second. All those in favor, raise your right hand. All opposed? I believe it carried it. 6-1.
Think about the road, but
Go make sure that 5-1. Whatever. Chip, would you like to take over again?
I believe I will.
Thank you.
Item number 16.
15.
Oh, excuse me, 15 is first.
I have a conflict. I'm going to recuse myself, step away.
Okay. All right, it says, consider and if necessary to take action on the resolution for payment of attorney fees that were proposed by the hospital district's attorney. So, John, I believe you put that on the agenda?
Yes, I'd be thrilled if we could go ahead and find some way to pay the first $25,000 of attorney's fees, if there are, to the attorneys in order to begin the operation of the entire insurance policy. And I don't know what the actual thing that Kevin Reed sent us was. We read it last time, and it wasn't agreeable with everyone. There were parts of it that were objectionable, I guess, to some.
So if memory serves me, Ron, you had some objections. What were your objections to, was it the way it was written, or the principle, or the?
no, it's the resolution that was drawn, and as I understand it, that resolution was drawn pursuant to a Attorney General's opinion somewhere back down the line that a board, if they were going to expend public funds to pay a deductible on an insurance policy, that they should find, or not find as the case may be, but if they're going to expend those funds, they should find that it is in the best interest of the residents of that particular district, which in this case, of course, is Somervell County residents, and not in the sole interest of the individual who may have been sued. And my position is that the whole time I've been on this district, that I have not seen anything that Mr. Harper has done that has been in the best interest of the residents of this district. And therefore, I can't in good conscience find that it's in the best interest of the district to pay $25,000 towards his attorney's fees, and that's the way I feel about it.
Just because he was on the board and has been sued for actions he reportedly did while sitting as a board member in session.
Did you hear what I said? I said that it says that it should be in the best interest of the residents of the district. If you've got somebody on board who does not do anything that's in the best interest of the residents of the district, then how can you spend taxpayer money to benefit that person? And I challenge anybody on this board, again, to list me one thing that Paul Harper has done on this board that's been in the benefit of the residents of this district and this hospital.
So is there any way that Kevin could write it that you would agree with?
Well, I think the issue is that that resolution was drawn under the guidelines that was put out in the Attorney General's opinion. And it makes perfect sense that if you're going to spend taxpayer money, that it must be for the benefit of the taxpayers.
Of course, I'm assuming probably the next step here is for Paul, I don't know this, but my assumption would be that Paul would then turn around and sue us, and so instead of giving Paul the 25, we'll give it to Kevin, and we'll ultimately give it to Paul.
He can do whatever he has the legal right to do, but I cannot, for one member of this board, I cannot sit here and pass and sign a resolution that says it's in the best interest of the district and the residents of the district to pay the money. So,
But it's like everything else, it's paying an hour, paying labor.
perhaps, but perhaps not. But I think you should do what's right regardless.
Well, so in that case, if the shoe were on the other foot and somebody here in town decides to sue you because they don't like the color of your car or whatever it is, because they saw what you were at a board meeting, then you would not feel that the board should kick in. Of course, I didn't realize when we got elected on the board that we had a $25,000 deductible on our policy. I believe what was stated in the first meeting is, hey, we got insurance, y'all are bonded, don't worry about it, we got this. And so, of course, I guess maybe we should look into it a little bit more. Of course, I didn't know we were going to start getting sued first right out of the box. I thought it'd take long.
Well, my position is, Mr. President, that if you do what's right, that you know in your heart and your mind is right for the residents of this district, you shouldn't worry about having to get sued. But if you come in here with a pre-made up agenda to do something, and that's the reason you get elected, and you start doing stuff like that, that's what's going to happen to you.
Let me tell you, every presidential candidate I ever voted for in my life was because of what he told me he was going to do. I never once voted for a guy because I thought he was a good old boy.
Well, I'll just say this and I'll stop. But when you get on this board now, you know, some members of this board probably had preconceived notions about what the situation was concerning this hospital. And all of you know that a lot of that, and I saw it in print, administration. He kept talking about administration. And you come into office thinking all you got to do is replace all of the administration of this hospital and everything will be fine. That's the farthest from the truth there is. If you come in and if you pay attention and you learn what the real facts are, then you shouldn't get up and make a motion to set the tax rate at 0, because you should know that that will shut the doors of this hospital. That's exactly what Mr. Harper did. That's what got him sued.
I think go back and check the video on that. It was not a motion, it was discussion.
Au contraire, I believe you go watch it. I watched it. He said, I moved. And we said it at 0.
Don't believe that's recognized.
It's neither here nor there.
All right. All right. Any further discussion?
I still believe we need to get our insurance working. I think we owe it to all board members who get sued for something they're doing on the board to be covered by the insurance policy we have to cover the board members for being sued when on board for actions on the board.
Is that a motion?
I'll move that.
So we have a motion on the floor. Is there a second? We have a motion and a second. Any further discussion? All in favor, raise your right hand. All opposed, same sign. Show that it's deadlocked at 3-3. No action is taken. All right. Item number 16. As required by 213 of the Hospital District bylaws, annually review and evaluate the administrator, discuss and necessarily take approved forms to be used by board members to evaluate the administrator, and establish time frame for evaluations to be completed and reviewed. All right, Ray and I discussed this today, and here's what I think. I think that what we ought to do is this form should not only be completed by the board. I don't think this should just be completed by Ray. What Ray and I decided is we thought that the department heads should also fill this out. And correct me with the terminologies here. It's the medical executive committee?
Medical
Is
staff.
that correct?
Medical staff executive.
Is the medical executive staff, and then I suggested 2 volunteers, which was Sharon Lawler and Gary Whittle, assuming that they want to do it, Ray will get in with them to do that, so that we kind of get a slice of the hospital. This is going to be a blind deal, and the plans is once we get this completed, we will get these to, I think we're going to actually take them to Lindsay to begin with, and then Lindsay and Kelly. Lindsay's raised AA for those of y'all that don't know, and then Kelly Van Zandt are going to come to this, and they're going to come up with some sort of way to kind of give us a synopsis of what came out of this. Does that make sense? So that it'll somewhat be graded on the curve, and I don't think it'll be necessarily as simple as like what our dashboard is, but I don't really want it to come to me like the Finance Committee deal does, where it's 28 pages. There has to be a happy medium in there to where it's something we can digest. And so, and the same thing's true, I don't want to lump the next thing in, but the same thing's true as far as the board. And I'll tell you what I told Ray, I've never taken a test that I knew all the answers to that I failed. And so I don't think it's fair for the board necessarily just to grade themselves. I would like the board's responses to be separate in one column, and I would like the department heads to be in one column, and I'd like for the medical executive committee to be in one, and I'd like the volunteers to be in one, so that we can kind of see what it is, and come up with it. But
I would like to ensure that any of the board members that want to say something that's not actually a part of any of the forms, they have an opportunity to say that as well.
Yeah, there's
there's a comment section on there.
last page has that.
And so
That's for comments.
I'm asking y'all, I'm assuming that y'all looked at this in your packet, and so,
So my complaint is that this is not the agenda item that I asked to be in the agenda. Somebody modified it. And I'm curious who it was, whether it was the secretary, the president, or Mr. Reynolds.
it was Dr. Burrows and I worked on this and decided to
reword what I asked to have on the agenda.
No, I thought we would add to it what we were actually planning to do, so there will be more clarification as to what we were going to speak about and arrange during the meeting.
But you eliminated the second sentence. My second sentence was consider and take action if needed regarding the administrator's employment, evaluation, reassignment duties, discipline, dismissal, complaints, or charges. That was removed from our request to have on the agenda.
Okay, well, that's
I
not...
apologize, I didn't
Okay.
realize that was...
Let me speak to that if I might too, because, you quote the bylaw, and the bylaw says exactly as it's stated on the agenda. The bylaw does not have the second sentence on this. It has in the bylaws. And so that's the way the agenda item was worded.
That's why it's
in the
quoted.
bylaws.
That's why it was quoted in the email.
Sir?
That's why it was quoted in the email that was sent when I asked for it. I said, in quotes, annual review and fellow commissioner, close quotes. Then the second sentence, consider and take action if needed. Whenever Mr. Hankins asked for something to be in the agenda, and I was secretary, I copied and pasted. I didn't revise it. When Dr. Burrows
Like I
asked
said,
me,
I apologize. My
said,
intention was not to revise it. My intention was to set up an order with which to do stuff.
I
And I
understand.
will not do it again.
Okay, thank you.
You thought you'd been board secretary for years, and here it is, your first week, and you're already getting in trouble. Okay, so what I said a while ago, does that sound like something that y'all agree to? Would somebody like to make a motion, or would somebody like to say, no, Chip, you and Ray are idiots, here's what we'd like to see done?
You're taking one at a time or both?
No, just one time.
Okay, good.
I don't disagree. You should have something in writing to provide feedback.
Sir?
I don't disagree that there should be something in writing to provide feedback.
Okay. So that was the one that just had kind of one choice of forms, right? Which one we've been using at the hospital for the last few years?
Yes,
et cetera, right?
what I did with this form is I took the form that we've been using to evaluate the CEO for years. And then I went to the bylaws, and any item that was in the bylaws that was not listed in the administrative responsibilities, I added that. So I believe I covered every item that's in the bylaws, plus the items that have historically been used to evaluate the administrator.
All right.
So we're going to have the ability to provide the feedback in writing and any extra if we want to verbally at the same time.
There is a form that you use to identify each item and score each item, and then the last page there is an opportunity for any other feedback. Yes.
I saw that comment section. I was wondering if that was it yet.
It will not be limited to one sheet.
No,
should it be one?
and my plan is to come in here in the next couple of weeks and us sit down and discuss this and say, okay, here's the way our stuff looks. And so I would like to see us set some sort of timeline. I think this is 3 or 4 agendas this has been on. Let's get this done and get it behind us. I'm tired of it, Ray is too.
Back to January.
And so my suggestion is if someone was to make a motion that they would put a timeline that sometime in the month of June, we put this to rest and we'll go on and do something positive and productive and get on down the road. So, like Dr. Burrows, would you like to make a motion?
I would like to make a motion that we proceed with forms and evaluations and gather that information together over the next month and make said announcements and recommendations based on that.
Okay, so we have a motion. Do we have a second?
I'll second.
We have a motion and a second. Any more discussion? All in favor, raise your right hand. All opposed, same sign. Shows it passes 7-0, Ms. Secretary. Item number 17, same song, second verse, it's just us instead of him. So,
Let me just comment on this real quick. I put a couple of forms. These forms were both received from Target for the board evaluation. And there's 2 separate. The first one is 1 page plus comments. The other one is several pages and quite detailed. If I might make a recommendation, I would suggest that we start with since it's our first time for the board, this board's self-evaluation, that we do the 1-pager to start with. But it's certainly, that decision is up to y'all.
does anybody have any thoughts on that?
And again, on this one, there's an opportunity for comments in addition to the scoring of the individual items.
Are we proposing other groups also?
Yeah, same way. Have that same kind of mix of stuff to get more of the whole pie instead of just a slice of the pie.
So we're going to evaluate ourselves and each other?
No, I think it would be that the board would be evaluated by ourselves and by other groups.
Yes, I think we would individually fill that out about ourselves, and then I think we would have the department heads, the medical executive committee, and 2 of our volunteers would fill out this same paperwork, and then somewhat of a blind study, Lindsay and Kelly Van Zant would get it and come up with some sort of something for us. Just like we were talking about dealing with the CEO evaluation. And just FYI, we're required by joint commission to have this in the event joint commission comes back. So, I mean, 2/3 of it's formality, but I'd really like to know what, I'm sure we're going to get an F, but I'm hoping I don't get an F minus.
So the evaluation is supposed to address compliance with the bylaws and implementation of the goals of the bylaws. That's going to be the focus of the feedback, right? Because that's how it's worded in the 2 to 6.
I'll be real honest, I welcome any comment, anybody that we have nominated to be on this grading committee to write down whatever they think, and just, don't call them on the other ugly names, but other than that, I mean, have at it. So did anybody make a motion, or are we still discussing? Did we? No, not on this one. This is separate. Okay, I'm sorry. So Ron, would you like to make a motion about this?
I'll move the same, basically the same wording as Dr. Burrows did on the evaluation of CEO for the board.
Okay. So we have a motion. Is there a second?
I'll second.
We have a motion and a second. Any further discussion? All in favor, raise your right hand. All opposed, same sign. Show that it passed 6 with 1 abstention.
I'll be sending this out to you separately, so it just has the information that you need, the CEO evaluation, and the form that will be used for the, and I'll make sure it gets to the department managers and the med staff executive committee and the volunteers.
Okay. So that takes care of 16 and 17. All right, so item number 18, which I know you've all been waiting for.
Actually, I object to this item. This has not been approved by the board to be given out. It's not in the bylaws. And I think it'd be great if you wanted to do that, if you ran it through the board and ran it through the medical staff's processes.
I'll tell you what, I'm going to go ahead and do it. So,
And I think that statement is absolutely ridiculous. Go ahead, Mr. President.
well, let me tell you, we did this. We started in December doing this, and Joey Hemrick, who's in charge of our, I want to say housekeeping, but that's not the right word. We may have a fancy name for it. Environmental care. Is that right, Joey?
Yes, sir.
And I'll tell you something else. Ray told me today that Joey's leaving. And I'm heartbroken about that. I like Joey. Joey's been a good employee for us. Joey was the first person to get this. And I'll be honest, I kind of started with this President's Award thing because I wanted somebody to let Joey and his crew know what a super job they were doing. But I was going to also say, I've never, ever, even though I'm selfish and I like having good people around me, Joey's one of the good people I like having around me. I want Joey to go back to college. I want Joey to graduate. I want Joey to prosper. I want Joey to get just so rich he's mean to me. And so I wish you nothing but the best, but I really hate for you to go.
Thank you very much. Appreciate that.
All right. For the month of March was our, I call it ER because I guess that's what we called it when I was growing up, but it's actually our ED, our emergency department. I noticed Shelly Turk was back there, and I was looking around. Is there anybody else? Shelly, stand up. Is there any? Yeah, Shelly. All right, everybody else sit on the floor. And so, I can't see all the way to the back. Is there anybody back there that's part of your crew? No? Good. Well, let me tell you what happened is you get to the president of the board and you make the mistake putting like your contact info on the hospital website. I get phone calls at home. My suit's cold. My blah, 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 and I get every gripe in the world. And I'm pretty quick to snatch up the phone and say, hey, Ray, so-and-so called. This is their gripe. Don't make them call me again. I've never gotten that call about our ER or ED. I'll tell you, I get just the opposite of that. I will go in, I was at the gas station one day, and this lady came in and she said, hey, you're that president of the hospital. Oh no, this lady, I'm fixing to take a whipping. And she came in and she said, Dr. Hoffman saved my life the other day. And she said, and she went on and on and on. If that was the only time I'd ever heard that story, I'd have said, we just easily got along with it. but that's not the only time. I hear that story almost every week. Somebody says, our ER, they caught it. You know, I've got this 1 in 10 billion, you know, nobody in the world would have ever thought that I would have had whatever this strange deal is, and our ER caught it. And so, thank you, Shelley. Usually we have a little party, and so Shelley was so excited that I think when I told her before I had a chance to announce, which is now, I'm thinking like April 1st or 2nd, we went in and had her party and stuff. And but I do thank y'all. Y'all have exceeded my expectations. Y'all make me proud to be here, and there's literally people that couldn't live without you. So thank you, thank you, thank you. All right. And so I'd gotten behind last year because of the way we started this. And so we're also going to do April so that I can catch up. And then here in a few days, we'll figure out who won for the month of May. But this crew is Marie, Renee, Sharon, and all those people that come in the hospital when I walk in the front door. When they answer the phone, they don't know it's Chip. You know, it's not Daddy Chip, I think some of y'all call me behind my back. That I even asked Marie one day, I said, do you like call upstairs and say, he's here, he's here? But they are pleasant. Marie smiles all the time. They're just, and I can tell you, I think that the ladies that are in the front, and maybe there's some men that come down there that I don't see, but I think those ladies, when you walk into the hospital, I think they represent us very well. I think they walk in the door and they're smiling, and they're happy, and they're jovial, and they're professional, and I stop and BS with Marie all the time. I can tell you, she'll give me the hand, and she snatches up the phone and takes care of business. But y'all do, y'all make us look good. And I think people that call into the hospital, and I probably call more than the average person does, they don't know it's me when they answer the phone. And every single time, it's professional, it's pleasant, it's positive, and I can tell you, there's days I'm not positive, you know, and maybe y'all seen those, maybe you hadn't, but I've never seen that, especially with the ladies down front. And so thank y'all for making us look so good. All right, item number 19 is public comments. So you've got about 2 minutes to discuss anything that was on the agenda you'd like to. Dr. Singh, come on up.
Sure. Thank you for acknowledging that we have wonderful employees here in this hospital. And you know, this community, okay, able to see that the board members doing something good for the community, okay? So all of us appreciate it. Now, the medical staff work very hard and save a lot of lives. All these employees here, you're talking about giving them 1% or 2%. They are not looking for your 1 or 2%, but you want to show them you appreciate them, the effort they put in for this community, you know, for the people of King Rose. That means more to these people. I think it is very important, you know, the people who work hard, you know, for all of you. Like, say, if you have a heart attack, I'm sure the nurses is going to, who is this, you know? That guy who spit at him, kick him. No, they're going to save your life to steal out as hard as, you know, anybody else. You know, I can guarantee you. So, the way I look at it is 1 or 2%. Come on, okay? The people will appreciate it. And that's what I want to let you know.
All right. Thank you, Dr. Singh. Anybody else have any comments? Don't hold back. We only listen to you here. Tomorrow I won't pay no attention. Joe?
I would like to say that I have witnessed some of the greatest acts of an excellent performance since I've been here 3.5 years. And I wanted to thank the community for letting me, or really the hospital, for letting me work there and serve you to the best of my ability. If I fell short in any way, please forgive me. But I hope the hospital prospers from now on into the future. And thank you very much for letting me be with y'all. I just want to get a degree, a bachelor's degree, before the kids get one.
No, and I respect that.
If I start now, I'll have 1 year's jump on the eldest one. So, thank you.
All right, anybody else? I'm ready to go home. I have some stories.
Motion to adjourn.
All right, we have a motion to adjourn. Do we have a second?
Second.
All in favor, raise your right hand. All opposed, same sign.